I'm Alicia Roufs. I am a person with vitiligo. I've had it since I was 3 months old, so 46 years now. And I run support groups here in Minnesota.
My name is Angela Lee, and I am a Biologic access coordinator. And I've been in dermatology for about 16 years now. I want to make sure that patients have access to the medication that they need. How has your life been with vitiligo? Like, tell me a little bit about that.
Growing up was tough. I'm the only person in my family with vitiligo. I didn't meet anybody with vitiligo until I was 16, so it was kind of an isolating feeling of no one to relate to, no one to talk to, no one to understand what I was going through.
There are a lot of patients that are suffering with this autoimmune disease. It's not just something that's cosmetic. And there's so many people that are just not educated on vitiligo, so when they see someone with vitiligo, they think it's contagious. It's important for people to know, hey, it's not contagious.
When I started the OPZELURA journey, it was kind of to help educate our community. I kind of wanted to test it out and see what would happen. I wanted to try it on myself, see what it was like, see if the repigmentation process really worked. And also I wanted to see what it took to get the drug. And that was kind of the bigger thing, like, okay, it's out there now, it's FDA approved. Granted, I tried not too far along after it was officially approved, so I knew there was gonna be some hurdles.
Programs are always changing, insurance formularies are always changing, so we have to constantly educate ourselves, reach out to peers, because some of the patients, they can get the medication a lot quicker. Some of them, it takes a little more battling it out, with those roadblocks, and I'm just kind of there to clear the way. I just always want to make sure that everything's thoroughly documented prior to submitting this information to the insurance. So it's just trying to collect as much history as possible.
It's a lot. It can be very, very overwhelming, but again, it goes down to being patient and persistent.
OPZELURA actually has amazing coverage. So it's available for over 80% of commercially insured patients nationwide. And if it's commercially insured and it's covered, they can pay as little as $0.
We encourage people to talk to their doctor's office, work closely with their healthcare providers, with the staff. They're there to help you. And if you have somebody like yourself that works closely with you, then it makes that journey so much easier. But you have to be persistent, you have to be patient, and you have to be your own advocate.
I am their resource. I am their point of contact that's going to advocate for them, and I'm going to be the person that is going to help them along that way. And I just have to educate them as well, just to advocate for themselves. However, I always direct them to OPZELURAOnTrack.com because that is an additional resource. There are photos on there before and afters, which is amazing because it can give them realistic expectations.
I use that resource a lot, not just their website, which is super helpful, and the information you can provide your healthcare provider.
So Alicia, how did you feel when you were able to gain access to OPZELURA?
When I finally got the tube, it was like, oh, it was wonderful, because it's like, one, I never ever thought I would do treatment for vitiligo. I just never thought that was in the cards. It was something I could do at home, and it was so easy, and it just came to my home, and it was so exciting, and I was really excited to try it. As someone who has had vitiligo forever, I have learned to be very comfortable in my skin. But now that I'm into it, and I've done this for over a year now, it's like, wow. I did not expect it to work on somebody who has never done anything before, and to have it almost completely fill in where I've treated it. It's been amazing. Do a little research. The doctor is there to help you. And so you need to make sure you're asking for what you want and what you need. The dermatologists have a very short amount of time to talk to you. So as much questions as you can prepare ahead of time, write it down if it helps you remember it, but rely on also the staff and the nurses too, because a lot of times they're the ones doing all the work behind the scenes. When people are brand new to an office and they don't know anybody, yeah, you kind of have to develop that rapport, and if you're scared, bring somebody with you too. If maybe you don't have the loudest voice, bring your mama who's gonna fight for you.
Your mama's gonna fight for you.
Yeah, you know, like bring somebody that's gonna fight for you. You know your body, you know yourself, you are your strongest advocate.
Indication and usage. OPZELURA is a prescription medicine used on the skin, topical, for the treatment of a type of vitiligo called nonsegmental vitiligo in adults and children 12 years of age and older. The use of OPZELURA along with therapeutic biologics, other JAK inhibitors, or strong immunosuppressants such as azathioprine or cyclosporine is not recommended. Important safety information. OPZELURA is for use on the skin only. Do not use OPZELURA in your eyes, mouth, or vagina. OPZELURA may cause serious side effects, including serious infections. OPZELURA contains ruxolitinib. Ruxolitinib belongs to a class of medicines called Janus kinase, JAK inhibitors, which are medicines that affect your immune system and can lower your ability to fight infections. Some people have had serious infections while taking JAK inhibitors by mouth, including tuberculosis, TB, and infections caused by bacteria, fungi, or viruses that can spread throughout the body. Some people have been hospitalized or died from these infections. Some people have had serious infections of their lungs while using OPZELURA. Your healthcare provider should watch you closely for signs and symptoms of TB during treatment with OPZELURA. OPZELURA should not be used in people with an active, serious infection, including localized infections. You should not start using OPZELURA if you have any kind of infection unless your healthcare provider tells you it is okay. You may be at a higher risk of developing shingles, herpes zoster, while using OPZELURA. Increased risk of death due to any reason, all causes, and major cardiovascular events. Increased risk of death and major cardiovascular events, e.g. heart attack or stroke, has happened in people 50 years of age and older who have at least one heart disease, cardiovascular risk factor, and are taking JAK inhibitors by mouth, especially current or past smokers. Cancer and immune system problems. OPZELURA may increase your risk of certain cancers by changing the way your immune system works. People taking JAK inhibitors by mouth have reported lymphoma and other cancers and are at higher risk of certain cancers, including lymphoma and lung cancer, especially if they have ever smoked. Some people have had skin cancers while using OPZELURA. Your healthcare provider will regularly check your skin during your treatment. Limit the amount of time you spend in the sun, wear protective clothing, and use a broad-spectrum sunscreen. Blood clots. Blood clots in the veins of your legs, deep vein thrombosis, DVT, or lungs, pulmonary embolism, PE, can happen in some people taking OPZELURA. This may be life-threatening. DVT and PE have happened more often in people taking JAK inhibitors by mouth who are 50 years of age and older, and with at least one heart disease, cardiovascular risk factor. Low blood cell counts. OPZELURA may cause low platelet counts, thrombocytopenia, low red blood cell counts, anemia, and low white blood cell counts, neutropenia, lymphopenia, leukopenia. Your healthcare provider may do a blood test to check your blood cell counts during your treatment and may stop your treatment if signs or symptoms of low blood cell counts happen. Potential risks from Janus kinase, JAK inhibition. Cholesterol increase has happened in people when ruxolitinib is taken by mouth. Tell your healthcare provider if you have high cholesterol or triglycerides. Low blood sugar in people with diabetes has happened after taking JAK inhibitors by mouth. Before starting OPZELURA, tell your healthcare provider if you have an infection, are being treated for one, or have had an infection that does not go away or keeps coming back. Have diabetes, chronic lung disease, HIV, or a weak immune system. Have TB or have been in close contact with someone with TB. Have had shingles, herpes zoster. Have or have had hepatitis B or C. Live, have lived in, or have traveled to certain parts of the country, such as the Ohio and Mississippi River valleys and the Southwest, where there is an increased chance for getting certain kinds of fungal infections. These infections may happen or become more severe if you use OPZELURA. Ask your healthcare provider if you do not know if you have lived in an area where these infections are common. Think you have an infection or have symptoms of an infection such as fever, sweating, or chills, muscle aches, cough or shortness of breath, blood in your phlegm, weight loss, warm, red, or painful skin or sores on your body, diarrhea or stomach pain, burning when you urinate or urinating more often than usual, feeling very tired. Have ever had any type of cancer or are a current or past smoker. Have had a heart attack, other heart problems, or a stroke. Have had blood clots in the veins of your legs or lungs in the past. Have or have had low white or red blood cell counts. Are pregnant or plan to become pregnant. It is not known if OPZELURA will harm your unborn baby. If you become exposed to OPZELURA during pregnancy, you and your healthcare provider should report exposure to Incyte Corporation at 1-855-463-3463 or www.opzelura.pregnancy.incyte.com. This registry is intended to collect information about the health of you and your baby, are breastfeeding or plan to breastfeed. It is not known if OPZELURA passes into your breast milk. Do not breastfeed during treatment with OPZELURA and for about 4 weeks after the last dose. After starting OPZELURA, call your healthcare provider right away if you have any symptoms of an infection. OPZELURA can make you more likely to get infections or make worse any infections that you have. Get emergency help right away if you have any symptoms of a heart attack, blood clot, or stroke while using OPZELURA, including discomfort in the center of your chest that lasts for more than a few minutes, or that goes away and comes back. Severe tightness, pain, pressure, or heaviness in your chest, throat, neck, or jaw. Pain or discomfort in your arms, back, neck, jaw, or stomach. Shortness of breath with or without chest discomfort. Breaking out in a cold sweat. Nausea or vomiting. Feeling lightheaded. Weakness in one part or on one side of your body. Slurred speech. Swelling, pain, or tenderness in one or both legs. Tell your healthcare provider right away if you develop or have worsening of any symptoms of low blood cell counts, such as unusual bleeding, bruising, tiredness, shortness of breath, or fever. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. The most common side effects of OPZELURA in people treated for nonsegmental vitiligo include acne at the application site, itching at the application site, common cold, nasopharyngitis, headache, urinary tract infection, redness at the application site, and fever. These are not all of the possible side effects of OPZELURA. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to Incyte Corporation at 1-855-463-3463. Please see the full prescribing information, including boxed warning and medication guide for OPZELURA at opzelura.com.